My name is Marcy Davis, and I am the coordinator for the medical assistant program at Blackhawk College. A medical assistant works in mostly clinics, offices, and they're going to be able to work in the front of the office and the back of the office. And that's what makes you so versatile and is a great selling point on your resume. So you learn the front office and the computers and checking in patients and keeping the schedule, confirming the schedule. In the back, you do more of the lab skills, which would be phlebotomy, injections, assisting with certain examinations and positioning. So that's the front and the back of the office. When you start first semester at Blackhawk College, you're going to take anatomy and physiology. And we're also going to take medical terminology. And we try to make those courses so that they align with each other. So when you're studying a certain system in med-term, you will be studying it in anatomy and physiology as well. Then you'll take Intro to Insurance, which is taught online. And then you also take Clinical Competency 1 for medical assisting. This is where you're going to learn how to take vital signs, how to give injections, how to do patient histories. So that's the first semester. Second semester, you're going to come back and you're going to be in Clin Comp 2. So you'll do more of the EKGs, venipunctures. Also, you will take law, ethics, and medical liability, which is where we will talk about the ethics and the standards and how it affects and relates to medical assisting. Then you will take pharmacology, terminology, so you'll learn about the classifications of medications and what they do. You'll take medical office procedures, and that's where you actually learn kind of the flow of the office and the day-to-day workings within the office, especially more of the front office. So that's what you'll take. And then you'll be ready, as long as you pass all those courses with a C or better, you'll be ready for internship. Internship is in the summer. It's 8 weeks long, but you do not have to do all hours within 8 weeks. We do have extensions. So if you're working somewhere else and trying to get internship hours, we work with you.
I chose Blackhawk because I'm a mom and I worked full-time, and Blackhawk allowed me to do most of the schooling online minus the one in-person class that I was able to get off for.
They were really flexible with hours, like when you can come in, things like that, and I like how they offered 1 day a week instead of multiple. It's harder to get off work for that.
Like I mentioned, many vacancies for employment in medical assisting. With that came a definite raise in salary. When I started here 7 years ago, it was $12 to $14 an hour. Starting pay seems to be between $16 to $20 an hour. So it is taking a huge jump. Medical assisting is a great starting point for any healthcare program here at Blackhawk. It gets you in the offices, it gets you learning how to talk to people, how to get histories. So it's like an introductory to the healthcare world.
Really would like to be a nurse someday, but I have 3 kids at home, so medical assisting will get my foot in the door and help me decide if I want to do nursing as a long-term career.
Always wanted to be in the medical field. I just wasn't quite sure, but since I had my child, it was a lot easier to choose medical assisting. There's a lot of different options that you can choose, and that was just really helpful.